All right, so good morning once again. We will continue with SAS 7 to 8. For this particular lessons, we do have Betty Newman's systems model. So when you talk about Newman systems model, it has something to do with the reshape in terms of the nursing curricula, integrating holistic and systems approaches in education setting. We do have an emphasis into its comprehensive assessment of patients' physiological. When you say physiological, those are the needs and wants of our patient. We have the psychological, more into the mental, and social cultural dimensions for effective care. Stress management framework has offered structured way to identify stressors impacting patients and even facilitating tailored interventions for recovery. So, what are the sources of the theory development? Newman's theory synthesizes psychology, sociology, and physiology to create multifaceted approach to care. So this is more into the holistic type of care for our patient. The model's foundation is systems theory, facilitates understanding patient interaction within broader healthcare environment. And for the clinical impact, it's more into the experience, which informs her theoretical framework, enhancing its applicability in the nursing practice. So, what are the major concepts? The client system is perceived holistically, encompassing integrated physical. When you say physical, into the exterior part of the patient, psychological, sociocultural, developmental, and spiritual components. So when you talk about spiritual, it has something to do with religion and culture. Understanding stressor. Stressors are defined as both internal and external forces that disrupt equilibrium of patient system. At the same time, the lines of defense and resistance of function as protective barriers that maintain the integrity of client system. So we do have some major assumptions of the meta paradigm. So the open system concept has something to do with the individual or group operate as an open system, dynamically interacting with various environmental factors. When you talk about the environmental factors, it has something to do with the diseases, with the illness, with regards to the person in the environment that they are able to meet. In terms of health continuum theory, the health exists on a continuum influenced by stressor that interact significantly with the client system's environment. And when you talk about examples of stressors, these are the illnesses, the diseases, internal and external factor that can affect the physical, psychological, social cultural parts of our clients or patients. The surrounding environment substantially shapes and affect the operation of the client's health system dynamics because if there is this effect to the health of the patient, it is not in an equilibrium or it is not anymore balanced. So someone should have compensate in terms of the disequilibrium or inequilibrium. The use of empirical evidence has something to do with the interventions. With the research indicates that Neumann-based interventions markedly enhance patient outcomes related to stress and holistic care. So what are a very good example of Betty Newman's intervention? This is how we try to improve the physical look of the patient, how we improve the mental health of the patient, and even the social cultural support. A very good example of which is how we try to consider hygiene for physical aspect or psychosocial, psychological or mental. It's more into health teaching of mental awareness or mental stress. Okay? Another thing is social cultural support as to how we can enhance its cultural beliefs and understanding. Diverse healthcare application of the model has a versatility in demonstrated thoughts, no? Through rather successful implementation across various healthcare settings and specialties. And the model promotes a patient-centered approach, ensuring tailored strategy address individual needs and care delivery. So this is more into patient-centric or patient-centered. For the assertions, the model categorizes interventions into primary, secondary, and tertiary prevention to optimize patient well-being. When you talk about primary, it has something to do with the independent interventions that you are doing. Secondary has something to do with the doctor's order, and with tertiary, it has something to do more into the extensive management of the patient. So say, for example, more into the chemo treatment or even collaborative practices are already involved in the tertiary level. Lines of defense. Strengthening lines of defense enhances the patient's resilience against stressor for improved health outcome. So the lines of defense is more into the prevention and promoting of health. No, we prevent no certain diseases that it would somehow aggravate or it will occur. Optimal wellness has something to do with the goal of nursing interventions, which is to attain the highest level of wellness amidst stressor. Logical form, structured patient care framework with a model facilitates systematic assessment, diagnosis, and intervention through its comprehensive system-based approach. So it's very important that we have to consider assessment first before doing certain interventions, because if you're doing interventions without any assessment, for sure that would somehow not be effective if you're going to provide it to your patient. Subsystem interactions, that has something to do with the model, emphasize recognizing the interactions among subsystems for holistic patient care strategies and assessment. And when you talk about comprehensive client assessment, excuse me, has something to do with holistic evaluation of patients incorporate physiological, psychological, social dimension within healthcare setting. It's very important to consider as well its effect to education and research. As the model integration in the nursing curricula, it exemplified the emphasis on comprehensive holistic patient care education. When you say holistic patient care education, from cephalocaudal, from the top to bottom, you are able to identify certain problem to your patient. And with that certain problem, you're creating nursing diagnosis, some interventions, and even proper planning. And we talk about the impact in research as numerous studies utilizing the model, which validates its effectiveness in stress management and system stability. Very important that it also recognizes its versatility, that the model's applications span both clinical environment and community health initiatives are also being noted. For the application in the hospital and school setting, stress reduction in the hospital. In the hospital setting, the model guides tailored care plans focused on stress reduction and holistic approach. When you talk about stress reduction, it has something to do with the signs and symptoms that we're able to reduce in order for the patient not to experience stress. External factors such as the environment can be considered as a stressor, and the job of the nurse and even the student nurse is to reduce such in order for us to have a holistic approach to the patient for them to attain equilibrium. Neuman's framework is also incorporated into the nursing program, emphasizing crucial assessment of stress reversibility. For student nurses, it's very important that they know how to assess. No? So we do have a certain subject here with nursing as part of our curriculum, which is more into health assessment. And the student nurses will be able to make sure how they can certainly assess uh, certain parts of the body or certain systems of the body, no, in terms of um, how they be able to do the proper way or sequence, no, in assessment. Promoting system stability, the approach fosters nursing practice that prioritize system stability and enhancing overall patient wellness in diverse settings. So further development, ongoing adaptation of Neuman's model ensure relevance to modern healthcare dynamics and evolving patient needs. And expanding applications in mental health, nursing illustrates the model's flexibility in addressing diverse therapeutic scenario, and continued studies aim to tailor the model for varied populations, enhancing its effectiveness across different settings as well. So for the critique of the theory, the complexity of Newman's model can hinder its application, necessitating streamlined guidelines for practitioner. And quantifying stressors and defense line poses challenges, limiting empirical validation and practical applicability of the model. And stronger specific directives are crucial for varying healthcare contexts to ensure effective utilization of the theory. So basically, if this is being done in the hospital setting, there should be proper guidelines and proper procedure as to what we consider the limitations of the nurses that they can perform to the patient or even with the student nurses limitations. So to summarize, Neuman's model uniquely integrates multiple system components, promoting comprehensive assessments of individuals' health need, and the framework effectively identifies and addresses various stressors impacting patient systems across different scenarios. And despite with all the critics, the model remains foundational in nursing education, influencing the curriculum towards holistic practice. Okay, now let's proceed with the adaptation model of Sister Callista Roy, or Roy's model. When we talk about her credentials and even her background, the adaptation model integrates various nursing theories, drawing from system theory and adaptation construct. And when you talk about the central to the model are persons, environment, health, and nursing, which emphasize again a holistic care principle. Her model has profoundly influenced nursing curricula, fostering critical thinking and adaptive practice among students. So systems theory integration, Roy's model effectively incorporates system theory, emphasizing the dynamic interaction with healthcare environment. At the same time, the framework is notably influenced by Halson's adaptive level theory, highlighting perception and adaptation processes. And it synthesized multidisciplinary insights from psychology, sociology, and human development to enhance nursing practice. So the major concept has something to do with a continuous adjustment by individuals to maintain stability amidst environmental changes and stressor. The individual or the patient should know how to adapt with the different factors that would hinder or affect or even help him or her in terms of recovery. A very good important way that our patient would somehow adapt with certain environment is to make sure that whatever the management giving, patients must be able to adapt or be able to get it in a way that it will improve his or her condition. For the type of stimuli, we have the focal, contextual, and residual stimuli interact dynamically, shaping individuals' responses in the adaptation process. And when you talk about focal, it's more into the certain actions that are being done, contextual in terms of theories, which is applied into practice, and residual, it's more into the combination of both practice of the empirical evidences and even with the contextual aspect. In modes of adaptation, we have the adaptive modes categorize how individuals respond, how they respond in terms of the interventions that we are giving to them, particularly with the physiological, self-conceptual, with their roles and with them to have interdependent ways of collaboration in terms of enhancement of their health. So there are major assumptions based on the meta paradigm. So the primary goal of nursing is to facilitate individuals' adaptation, fostering optimal health and well-being. As nurses, we have to make sure that our patients are well educated as to how these interventions are being done, that they'll be able to adapt it and they'll not be able to neglect it. No? In terms of holistic person concept, individuals are seen as biopsychosocial beings which engage interactively with their dynamic environment continuously. And with a health definition, it is being perceived as an integrative process, emphasizing becoming whole and balanced through adaptation. When you talk about the use of empirical evidences, Roy's model effectively facilitates adaptive responses in patients facing chronic illnesses across various contexts. Because these patients who are experiencing a disease in more than 6 months of their entire life, it's one way for them to consider adaptation with a certain scenario. No, let's say, for example, your patient is hypertensive. There come a time that at the very beginning, your patient would be in a denial, and sometimes, of course, self-pity would occur. And our role for that nurses is to consider and guide our patient to have that kind of experience of that kind of process, because everyone will be able to experience such, no? However, it's very important that with the transition of how we'll be able to accept having that kind of chronic illness of hypertension, at least the nurses still educate the patient and still instill to its mind the importance of complying with medications, changing of lifestyle, also considering independent measures in such a way that there is no doctor's order or dependent measures. Okay. We also have diverse clinical application, with numerous studies validate the practical application of Roy's model with multiple clinical setting, enhancing care delivery. So this is more into the hospital setting, and it's being emphasized that your patient inside the hospital must be able to adapt with certain management. Empirical evidence supports the efficacy of Roy's model, reinforcing its role in nursing education and practical setting. For the assertions, no, it is an adaptive interventions where nursing interventions must be tailored to stimulate positive adaptations, enhancing patient response to specific challenges. Also recognize individuals' differences is very crucial. These variations significantly influence personalized adaptive responses in healthcare. And health and adaptation, this achieves optimal health outcome depends markedly on effective adaptation strategies employed within the nursing practice. So there come a time that some of our patients are not amenable of what we are doing. However, that's really the right of the patient as part of our patient-centered care. That patient also has the right to refuse if they'll not be able to, if they are not able to, if they are not pleased with the interventions that are given. No. However, with that kind of situation, no, for us nurses to at least defend ourselves, no, we really have to ask for a waiver from our patient in terms of those medical management that aren't amenable to them. We have logical form. It's more into the model structures, patient evaluation, emphasizing systematic recognition of stimuli affecting adaptive responses. And also, we do have a comprehensive examination of the patient's adaptive modes, supports tailored interventions for individualized care. So that is very important for us to build rapport to our patient, because in that way, in that very first step, it's one way that we can build trust to our patient. And once patient builds trust to you, they'll be able to adapt of what we are doing or what they are getting. Also, the stimuli identification has something to do with the systematic identification and analysis of stimuli, ensure effective intervention strategies that promote positive adaptation. So a very good example of which is your senses. No, so if you're going to use your mouth for verbal communication, whether would it be nonverbal or verbal cues, no, it's one way for us to make sure that we provide effective intervention. Another thing, if we're going to use some of our senses in terms of proper hearing and even eyesight with proper assessment, hearing for effective communication, then it promotes positive adaptation to our patient because they're being recognized and being observed that what they're doing is correct or even wrong. And we can somehow give them some idea as to how to improve the wrongdoings and better what are the right things that they are doing to enhance health, to enhance their health. Acceptance by nursing community in terms of education and research has something to do with the foundational framework, in the nursing education, which promotes holistic and adaptive care. At the same time, the foundational research underpins extensive research studies focusing on adaptation mechanism that influence patient health outcomes significantly. And for the theoretical contribution, the knowledge for its role in evolving nursing theories, the model advances both theory and clinical practice. So its application to the hospital and school setting, it aids in developing care plan to optimize patient adaptation amid illness and treatment. So you have to categorize whether this would be a primary intervention or secondary intervention in such a way that your patient who is ill and is being treated can somehow adapt based on the plan that you are doing. And for the integration in the education has something to do with the nursing curricula. That model teaches students the significance of adaptive process in healthcare. That, say, for example, a nursing student who is a first-year nursing student must be able to know how to adapt what nursing is all about. With his or her idea during the start of her journey as a student nurse, it's very important that he or she should study in advance with the subjects given, should understand the curriculum as to how would it affect his or her journey as a nurse or as a student nurse for his or her 4 years of experience with the school. Okay? You also have the nurse's role, which highlights the integral role of nurses in assessing and fostering adaptive responses among patients. For further development, we do have an ongoing refinement which ensure adaptation model addresses contemporary healthcare challenges and improves patient outcome. And application of the model are increasingly recognized in mental health and community care setting nowadays, enhancing care delivery. And with the research, it continues in adopting the model for diverse population, ensuring culturally competent nursing interventions globally. For some of the critics, no, we have the implementation challenges. For the model's complexity creates barrier, complicating its application in a real-world clinical nursing practice. Because there come a time that there are certain instances that patient won't be cooperative of what you are doing. There are times that your patient will not be able to communicate with you due to certain disability or chronic illnesses. No? Also, with operationalization issues, measuring adaptive responses, which is really difficult, hindering the practical execution of Roy's theoretical framework. And critics call the developed guidelines to enhance clarity in applying the model consistently with diverse setting. And to summarize, the model underscores adaptation role in optimizing patient care through individualized nursing strategies. And the model establishes a structured approach for navigating complex clinical scenarios effectively. And with despite all of these critics, the model is internal and enriching nursing curricula, fostering a deeper understanding for adaptation. Okay, and let's proceed now with Dorothy Johnson's behavioral systems model. Good to know about Johnson's, born in 1919. Johnson's early experiences fueled her passion of nursing and education and was distinguished himself a prominent nurse theorist, emphasizing systemic approaches to patient care. 1968, that she developed the behavioral system model, which is melding behavior and biological sciences into nursing. So when you talk about the sources of the theory development, it is being influenced with the systems theory because it reflects systems principle, emphasizing interacting and interdependence among healthcare components. And at the same time, its root came from the behavioral sciences of Johnson's model, which incorporates psychological frameworks to inform patient care strategies. And the model synthesized nursing, biological science, psychology, sociology, and anthropology, promoting a comprehensive healthcare perspective. So some of the major concepts, Johnson's behavioral system consists of 7 subsystems guiding individuals' behavior within healthcare dynamic. And each subsystem, attachment, affiliative, dependency, ingestive, eliminate, sexual, aggressive, and achievement, plays a vital role in patient interaction. So in order for us to achieve proper care to our patient, we really have to address the dependency in the ingestive or the way your patient will somehow eat, eliminate both with the urine and also with the stool, very important as part of physiological needs. Also the sexual, as to how we can enhance the sexual part or orientation of the patient, aggressiveness, and even the achievement while they are still confined in the hospital setting. So that's just an example. No? So equilibrium sustained by these subsystems ensure overall well-being, adapting behavior to promote health and recovery. So its primary purpose is maintaining or restoring balance with the patient's behavioral system. Because if those 7 systems are not being addressed, your patient won't be able to attain health or won't be able to achieve or balance his health perspective or health condition. With a complex personhood, it views and recognizes personhood as an interconnected behavioral system influencing health and recovery. So, in order for the patient to recover, those 7 subsystems must be met. Okay? Environmental influence has something to do with the environmental factors, necessitating a holistic perspective in patient care. So its empirical evidence in terms of research validation has numerous studies validates Johnson's model, demonstrating improved patient outcome through effective behavior management across clinical environment. The model has been successfully implemented in diverse settings, promoting health behavior and enhancing patient engagement strategies. At the same time, with nursing education, it increasingly incorporates its principle, fostering critical skills for managing patient behavior effectively. So, in this way, we are already training our nurses to have your to anticipate as to what to do to your patient in terms of providing care. So say for example, if your patient would like to go to the bathroom, then you have to consider some of the toiletries that you're going to prepare. The safety of the patient must be considered, and at the same time, you accompany the patient while they are going to the bathroom to at least urinate or pee or even defecate. No, that's very important to address its subsystem. Another very important thing, is their mental health. We have to consider as well some questions related to addressing mental problems, or mental concerns coming from your patient. With a simple verbalization coming from the word of mouth of your patient, it's very important to document and identify that. And once you noted that this can be considered as a problem, then you have to anticipate what are the certain interventions that needed to be done. So, say, for example, you would like to have proper counseling of the patient, or certainly having your patient verbalize certain thoughts and feelings. It's one way or another, we're lending an ear from our patient, based on the concerns, based on her condition, and anything that she wanted to share to you, which hinders her mental capacity. We also have the educational impact. In the nursing education, it increasingly incorporates the principle fostering critical skills for managing patient behavior effectively. In a way, na we are considering as well some research, or research studies for the principle of Johnson's model. So some of the assertions are considered while doing nursing intervention. We consider that this will restore equilibrium, addressing disturbance in behavioral systems for optimal health. We also have to consider that understanding behaviors necessitates considering environmental context, underpinning patients' responses and healthcare outcome. At the same time, balancing needs and responses of subsystem facilitates comprehensive care and promotes holistic patient health. So for the logical form, we do have systematic system, that the behavioral system model emphasizes systematic assessment of subsystem to understand patient behavior intricately. And interaction among the seven subsystems highlight the complexity of patient behavior within the healthcare environment, because it's totally different as to how every patient would somehow adapt. And behavioral equilibrium factors is a comprehensive evaluation of various factors which helps maintain the behavioral equilibrium essential for patient well-being. Its acceptance in the community, education, and research. Johnson's model is widely accepted in nursing education, enhancing curricula to incorporate behavioral science principles. The model serves as a robust basis for behavior management research, driving innovation in nursing practice. And at the same time, contributions are recognized for evolving nursing theories and integrating behavioral science into clinical practice. So what are its application in the hospital and school setting? So Johnson's model enables development of tailored care plans focusing on patient behavior in hospital setting. So when we talk about the behavior of the patient, how the patient will somehow respond to the medical treatment, a behavior as to the physical aspect, as to how aggressive your patients are responding to the treatment, as to how your patient would somehow coordinate with you or even talk to you. That's part of the behavior of your patient that you're also considering in your care plan. We also have behavioral system models, which is incorporated into nursing curricula, emphasizing the significance of behavioral understanding. And understanding behavior promotes effective healthcare delivery, enhancing patient outcome in varied environments like the school. So further development with an ongoing advancement of Johnson's model, which is really crucial for addressing contemporary healthcare challenges effectively and expanding mental health application. The model principles are increasingly applied to mental health system, enhancing patient-centered care practices, and focuses on diverse population, which is being adapted to better serve diverse population, ensuring inclusive healthcare delivery. Some of the critique would include the neglect of holistic care, and critics argue Johnson's focus on behavior may overlook other crucial aspects of patient-centered care, and challenges persist in accurately measuring behavioral equilibrium, complicating the implementation of Johnson's model, and call for more specific clinical guidelines arises to enable consistent application of the behavioral model. There come a time that the behavior of the patient is unpredictable. No? There come a time that there is a day your patient is really cooperative. There come a time that your patient is not. No, so as a nurse, we have to adjust what we can do to our patient because that's very important. That we have to consider the things that are need to be done. We have to plan before we try to implement. No, because not all patients are the same. So to summarize, the model offers comprehensive framework for assessing and understanding patient behavior holistically and also remains foundational in nursing, guiding care specifically tailored to individuals' behavioral needs. And despite with these critics, the model is critically valued for enhancing interpretation of patient behavior in nursing. All right, so let's go now to Hildegard Peplau's theory of interpersonal. So just some credentials and background of Peplau. Peplau was born in 1909, revolutionized psychiatric nursing by introducing relational dynamics in care. And also Peplau's theory of interpersonal relation was articulated in 1952, enhancing understanding of nurse-patient interaction. Her work emphasizes the nurse-patient relationship as a fundamental therapeutic process for positive outcome. So when you talk about the theory development, it has something to do with psychoanalytic foundations. Peplau's theory incorporates Freudian and Sullivan's insight, highlighting the unconscious dynamics of interpersonal relationship. Okay, and psychology impact, it has with the developmental psychology impact. No? Influences from developmental psychology shape understanding of psychological growth and the nurse's role in facilitation. For communication theory integration, has something to do with its principle from communication theory. This enhanced nurse-patient dialogues and promote therapeutic engagement as well, you know, to the patient and from the nurse. The major concept, the key phase include orientation, identification, exploitation, and resolution, each facilitating patient engagement and growth. So it's very important that we have to properly identify your patient, properly provide certain communication. Your communication skills are very important because it's one way for us to orient our patient. No? And nurses act as strangers, resource persons, teachers, and counselors, dynamically adapting to patient needs throughout interaction. So it's being emphasized that we have to interact with our patient, communicate with them in a way that we are able to provide proper care to them. No, we do act like the counselor. We provide advice. No, it's up to the patient if they're going to adopt it or not. Okay. Interpersonal process importance. The interpersonal process cultivates trust and feeling, crucial for effective psychiatric nursing and patient recovery. So major assumptions of the meta paradigm, nursing as a therapeutic process. Nursing transcends basic care, functioning as therapeutic process essential for patient psychological healing. We are considered as an instrument, no, as part of the assumption that with the nurses, we bridge certain interventions, certain problems, certain information that that our patient needs. Okay, we also have individuals as need-driven organisms. Patients are viewed as organisms striving to satisfy their needs, influencing both health and recovery outcome. And health as personal growth, which is conceptualized as ongoing journey of personal growth shaped by inner potential and external influences. So its empirical evidences in research, it demonstrates the effective nurse-patient communication significantly enhances therapeutic relationship and improve patient outcome. It's very important that we have to communicate with our patient because it's one way that we can build relationships to them. And of course, with proper communication, we will be able to improve the outcome of our patient because we are communicating them what is really right and what is good for their improvement. We also have empirical validation that research validates Peplau 4 phases of interpersonal relation across various nursing practice, environment and setting, which is your meta paradigm, and positive outcome identified findings reveal strong correlation between relational approaches rather, and reduction in patient anxiety and psychological distress. Because if we are going to communicate with our patient, it reduces the stress and also the anxiety of our patient because they can vent out, no, the things and what's in their mind. No, we're enhancing the mental capability of our patient in order for them to have um, a good mental status. Interpersonal nature for its assertion that the nursing practice fundamentally relies on interpersonal interaction, fostering connections vital for patient care effectiveness. We also have therapeutic relation significance that nursing hinges on the ability to cultivate therapeutic relationship that promotes healing and trust to patient. And the essence of nursing lies in developing meaningful connections central to enhancing patient engagement and outcomes. So, what are the logical form? It has something to do with the model that delineates the structured framework guiding nurse-patient interaction towards achieving therapeutic goals effectively. And some of the communication key elements would include communication, critical for establishing trust and facilitating patient-centered care adjustment. And at the same time, flexibility in patient care, which encourages flexibility, allowing nurses to adapt their approach based on individual patient needs and context. So, as nurses, we are there to guide with our patient. If the patient doesn't want to do such nor doesn't want to participate, then we still have to respect what the decision of our patients are. So acceptance by nursing community in terms of education and research has something to do with its integral to nursing curricula, emphasizing the development of essential interpersonal skills among nursing students. So as student nurses, we are able to enhance your interpersonal skills. One way of doing that is to properly communicate with your classmate. It's very important that you practice, no? Sometimes return demonstration with the collaboration and communication of your clinical instructor would somehow help you enhancing your skills. And for research foundation, the theory underpins numerous research studies, critically exploring interaction and their effects on psychiatric patient outcome. So the impact in psychiatric nursing, its contribution profoundly influenced psychiatric nursing, fostering therapeutic relationship pivotal for effective patient care. Because for psychiatric patient guys, our main focus is to establish a better mental health status. No, very important that we encourage our patient to verbalize by talking to them, communicating with them, collaborating. No, that's very important. So in terms of hospital and school setting, the theory is operationalized in hospital through structured intervention, focusing on nurse-patient relation dynamic. Nursing school incorporates the principle, enhancing future nurses' competencies in establishing therapeutic relationship. And with its assessments, emphasize the correlation between interpersonal relation, taught and improve patient satisfaction and recovery rates. So if we know how to build proper relationship with our patient, no, our patient will be able to satisfy on what we are doing. And at the same time, of course, since patient is really satisfied with what we're doing, the recovery rates would increase. So further development, the theory should prioritize tailored approach to diverse patient population, which is unique to its need. Ongoing research is examining the principles, ensuring relevance amidst evolving healthcare dynamics and practices. And the theory requires continual refinement to address modern complexities in nurse-patient interaction and expectations. So with the critic, it suggests that prioritizing nurse-patient relationship may obscure equally important facet of holistic care, which is correct, no? Challenges arises in applying Peplau's theory outside the psychiatric context, questioning its universal applicability in nursing, and calls for more rigorous empirical validation, no? More observation, more experience for us to urge comprehensive research on the theory broad-ranging impact. And to summarize, Peplau emphasizes the nurse-patient relationship is critical for therapeutic success, foundational in psychiatric nursing, and the structured understanding of interpersonal processes fosters effective communication and rapport between nurses and patient. And despite of critic, Peplau's theory remains essential in evolving nursing practice, adapting to contemporary care needs. Okay, I think this will be the last topic of Jean Orlando's theory of deliberative. Just the credential and background of Orlando, formative experiences propelled her commitment to advancing nursing education and practice globally. She emphasized the interplay of emotions and communication in effective nursing, shaping patient care methodology. And her theory continues influencing contemporary nursing practices, enriching nurse-patient interaction and health outcomes significantly. So the theory sources for the theory development of Jean Orlando's theory, the influence of a psychiatric nursing, no, which her experience as a psychiatric nursing informed her theory focused on emotional and psychological dimension. Her approaches incorporate no humanistic psychology principle, emphasizing the importance of empathy and understanding in nursing, and at the same time utilize communication theory concept, enhancing therapeutic relationship and fostering effective nurse-patient interaction. So, what are the major concepts? Nursing process involves continuous assessment, ensuring responsive care rather through established evaluation and planning phase. We also have recognized both verbal and nonverbal patient behavior is crucial to inform tailored nursing interventions effectively, and nurses must react strategically to patient cues, guiding actions that enhance patient well-being and recovery. So, with Orlando's theory, it's very important that we really have to start with assessment, followed by um, diagnosis, which is our nursing diagnosis. Another thing is the planning, intervention, and evaluation. So the AD5 process should be continuous, and with every step, the nurse must react strategically, somehow evaluate these particular steps in order for us to identify, what are the things need to be done and adjusted, and for the patient's well-being and recovery. So, what are the major assumptions in terms of meta paradigm? That nursing is characterized by intentionality, requiring thoughtful responses tailored to individual patient need and context. Each patient presents distinct behavioral requirement. Understanding these promotes personalized and effective nurse intervention. And the environment shapes patient interaction, influencing behavior, communication, and overall effectiveness of care delivery. So the environment can be adjusted in order for us to make sure that when we try to interact with our patient will be able to understand us in terms of behavior. Our patient will be able to perform certain tasks and will be able to adapt what we are doing. And of course, proper communication so that the care that we are delivering to our patient is considered to be effective. So evidence-based support in terms of empirical evidences validates the deliberative nursing process, underscoring its role in enhancing patient outcome across diverse settings. For acute care success, studies reveal significant improvements in care quality through enhanced nurse-patient interaction in acute healthcare environment. And positive patient outcomes are documented, highlighting the effectiveness of Orlando's approach in psychiatric nursing context. For its assertion, deliberate nursing actions are vital for addressing specific patient needs and fostering optimal healthcare results. At the same time, the prompt and accurate responses to patients' behavior enhance care efficacy, tailoring interventions to dynamic situations. And continuous evaluation of care strategies ensure nursing intervention remain relevant and responsive to evolving patient needs. So it's very important that we have to evaluate from time to time. So do not wait right after you're done with all your interventions. Is that the time that you're going to evaluate? It's important that we have to have an evaluation in every sequence or in every part of what we are doing for our patients. Say, for example, with assessment, after you're done with your assessment from cephalocauda or head to toe assessment, we try to evaluate if whatever assessment that you have for your patient are complete or not. So in that way, it can somehow suffice. For the logical form, Orlando's model provides structured framework guiding nurses to deliver focused, patient-centered care systematically. And critical observation skills are really fundamental, allowing nurses to interpret patient cues and adjust interventions accordingly. And the theory encourages nurses to engage in critical thinking, enhancing decision-making during complex patient interactions. So acceptance in terms of nursing community and education and research. So Orlando's theory is integral to nursing education because it emphasizes the development of meaningful nurse-patient relationship. The framework fosters research initiative focused on communication strategies, building patient-centered care model, and the theory informs diverse nursing contexts, enhancing practice through effective communication and relational understanding. So for the care plan development, the theory guides care plans in hospitals focusing on patient behavior for tailored intervention. And nursing curricula incorporates the theory emphasizing immediate nursing response to patient needs in educational setting and employing Orlando's principle highlight the significance of adapting nursing actions to evolving patient situation. So there come a time that if you're going to implement the systematic approach of your ADPI, the nurse would somehow end in the process of planning without doing intervention. Yes, there is an assessment, diagnosis, and planning, but it will be ineffective if it would be implemented. However, there come a time that if you're done with your planning, we really have to stop with the intervention because it didn't go through. One reason of which is that when you try to evaluate, it is not anymore effective to the patient or the patient's condition have changed. Okay. Say, for example, when your patient is still well on that particular hour, say, for example, 8 o'clock in the morning, the patient can still talk. When it was already 12 o'clock in the afternoon, patient deteriorated with its condition. No? Your patient's Glasgow Coma scale is already 3, so that's already bedridden due to certain complications without proper intervention. Then that that would come a time, no? That's the only time that we are able to stop what we are systematically doing rather than evaluate it again and somehow change it back, no? To and go back to assessment to check as to what would somehow fit or tailor fit for the current condition of the patient. But not all the time, guys, that you're in the hospital, your patients are well. At the very beginning of the admission, patient can still talk with a GCS 14 or 15, no? When you say GCS 15, patient's response is really good. The opening of the eyes is there, no? And patient can somehow react to certain stimuli, okay? And patient is converse, no? But if the disease of the patient or the condition of the patient is not well treated and somehow it will progress, tendency is your patient will deteriorate. That gives you a lower score of our Glasgow Coma scale. Okay. So further development, expansion into community-based setting that research explores Orlando's model application to community nursing addresses unique challenges and diverse patient interaction. And for technology integration, investigating how technology influences nurse-patient communication, which enhance deliberative nursing processes relevance for today. And for non-traditional nursing application, Orlando's theory is being examined for its effectiveness in specialized non-traditional setting, ensuring versatility and practice. And for the critic, in complex healthcare scenario, immediate responses can overlook broader relation dynamics impacting patient care. Long-term patient care requires nuanced approaches that the deliberative model may inadequately address in practice and calls for rigorous empirical research exists to substantiate Orlando's theory within varied nursing contexts effectively. And to summarize, nurse-patient interaction, this is central to Orlando's theory in the recognition of robust nurse-patient communication as transformational for care. Orlando's model introduces structure by nursing by emphasizing immediate and deliberative response to patient need. And despite with these critics, the theory remains essential in nursing curricula, influencing student perspective on care interaction. So questions will be entertained during our face-to-face class. And hopefully you'll be able to study with all your SAS for the upcoming exams.